Well, good morning and welcome to Alzheimer Society of Calgary's Facebook session. Joining me today, I'm Paul Bartel, Manager of Learning and Support Services here at the Alzheimer Society, and joining me is...
I'm Padma, Learning Specialist at the Alzheimer Society of Calgary.
And today we're planning to take about 10 to 15 minutes to talk a bit about the question of cannabis and dementia. Mm-hmm. So Padma, since cannabis was legalized a few months ago here, we've heard from quite a lot of people who've been considering it as an option for maybe helping with some of the symptoms or helping in the management of dementia. Maybe just to back up from that for a second though, what do we know about cannabis in older adults in general before we start considering the specific case of dementia?
Right, that's a great question. We need to know whether cannabis is safe and effective for older adults. And at this point of time, we do not have a robust evidence to say with confidence that cannabis is safe and effective for older adults. A few population studies were conducted before, but when you look at the quality of the studies, the evidence is actually weak because the studies were conducted in small groups of people and they were observational studies. People were followed up after 6 months to find out how they are doing. And many of these older adults were using cannabis for controlling cancer-related pain. And they reported that there was significant reduction in the intensity of pain and there was an improvement in feeling of well-being. But at the same time, there were side effects. Reported side effects are very minor, like dizziness and dryness of mouth. But when you look at the quality of studies, we understand that they are not well conducted, randomized controlled studies, not the high quality studies. So at this point of time, we do not have robust evidence to say that cannabis is safe and effective for older adults. We need more high quality studies.
I think it's probably fair to say we're kind of at a point where we really don't understand cannabis as an effective drug or medication for a lot of things, just because there has been such a little amount of research done. So building from that and already acknowledging that there isn't a lot of evidence around cannabis use and a lot of health conditions, is there some evidence about cannabis use and how it might be useful in modifying or helping with dementia?
Now, again, at this point of time, I need to say that we do not have any evidence to say that cannabis is useful for the treatment of dementia in human beings because no population studies have been conducted so far. And the only studies that have been conducted are on animal models and cell cultures in lab studies. And these studies, they used a synthetic form of THC, and they found that there was some improvement in memory and cognition, and they found that was coming from the effect of cannabis reducing the amount of plaques and tangles that were forming in the brain, and also decreasing neurodegeneration, the degeneration that's happening in the brain associated with Alzheimer's disease, and that was leading to some improvement in memory and cognition. But again, as I said, these are animal studies, and what works in animals need not work in human beings. We have seen from experience that many drugs that perform very well in animal studies, they fail miserably when applied to human beings. So actually, again, coming back to the same point, we need more high quality, well conducted studies before we can recommend cannabis for the treatment of dementia.
Okay. So one of the things around behavioral symptoms of dementia, sometimes psychotropic drugs are used, which come with a lot of different side effects and interactions. Could cannabis potentially be a better alternative to an alternative for the use of psychotropic drugs for managing some of those behaviors in dementia?
Right. So as you mentioned, these behavioral symptoms are a cause of huge concern for families, leads to early placement. So there's a lot of interest in the question that you asked, could cannabis be a safe alternative to psychotropic drugs, which come with a lot of side effects and provide just modest variable benefit? And again, here at least we can say that some population studies have been conducted. But when you look at the quality of studies, these were done in small groups of people ranging from anywhere from 2 to 30 at the most. And they were conducted for a short period of time, starting from 2 weeks to 14 weeks at the most. And they found that the synthetic form of cannabis, THC, called Nebulon, was able to reduce pain and anxiety in human beings, in participants in those studies. And because of that reduction in pain and anxiety, it was actually reducing the behavioral symptoms, in particular nighttime agitation and nighttime movements, that was reduced. And also the sleep duration was prolonged, and there was also improvement in amount of food consumed. So very positive, when you look at the benefits. But again, it's a quality of evidence when you look at it. That is where we have some trouble in accepting it, because these are, as I said, small studies, a short period of time. And also the participants, the studies reported that the participants had significant sedation. And just one last study I want to mention here. This was funded by the Alzheimer Society of Canada and was conducted at the Sunnybrook Health Sciences Centre in Toronto. Involved 33 people with moderate to severe Alzheimer's disease and significant agitation. And they used 1 milligram of the synthetic THC called Nebulon, and for 14 weeks. And they found that, as I said earlier, they found the same effects. There was reduction in pain, there was reduction in anxiety, reduction in nighttime agitation and movements, but it came at the cost of severe sedation. And the researchers reported that they were not able to come up with a dose that would provide the same benefits, reduce agitation, at the same time avoid sedation altogether. So they came to the conclusion that we need more high quality, well conducted studies to pursue this further, and then only we can say with confidence that this can be suggested as an alternative to psychotropic drugs. But there is some potential there, but at this point of time the evidence is not robust enough.
I'm sensing a bit of a theme.
Yeah, exactly.
Which is that we need more studies.
Definitely.
One of the things you mentioned there is that for the trials we do have, that there's been a significant indication of sedation. So let's talk about side effects. Cannabis, like any other drug, is going to come with side effects. So beyond sedation, are there some other side effects that people might experience?
Yes. So, many people think that this is a naturally occurring substance, so it should be safer. But as you mentioned, like any other drug, cannabis use is also associated with side effects. It's said that research has shown that 1 in 2 users can have significant sedation. 1 in 3 users can have the sensation of high and also have dizziness. So for older adults, there is a concern of falls leading from dizziness. 1 in 4 users can have low blood pressure, hypotension with the technical term, that is low blood pressure. That's again a concern for people with heart disease or any cardiovascular illness, that is a concern. 1 in 5 users have what is called a kind of dependency. It's called cannabis use disorder, but more common in people who have been using it for a long period of time and using it more frequently. And 1 in 6 users were reported to have even psychosis, so symptoms of hallucinations and delusions. If you're considering that for managing the behavioral symptoms, this seems to be exaggerating those symptoms.
Okay.
And moreover, another thing to remember is that it's not for everyone. It's not suitable for everyone. It should not be prescribed. It's contraindicated. Should not be prescribed, and should not be used by people who have a history of any psychiatric illness before, or any symptoms of psychosis before, or who have a family history of schizophrenia. It should not be used by people who have history of substance abuse in the past. People who are allergic to cannabis, it should not be prescribed, should not be used. Not to be used by people who have pre-existing heart disease or any cardiovascular illness, because of that risk of low blood pressure. It's not safe for those people. Again, absolutely contraindicated, should not be used by people with severe liver or kidney disease, because it's metabolized in the liver and it's excreted or removed from the body by the kidneys. So it tends to accumulate in such people and will increase the toxic effects, and cannot be used for people who are already taking any sedatives or psychoactive drugs. It cannot be, because it will increase those
Increase those effects.
Yeah.
Okay.
So there are some contraindications and some side effects at this point of time. We cannot, say with confidence, even though we hear, Paul, both of us, we have heard people say that, they have, their friend's mom has used, and, there was a sudden turnaround, very positive benefit. So doctors also say that some of their patients use, and there is some anecdotal evidence of its being beneficial for some people. But if you look at the science behind it, we do not have enough evidence at this point of time.
So you feel really confident.
Exactly, and the need of the hour is more high quality studies.
Okay, so I'm coming with, I think, two big takeaways from our conversation. One is we need more studies, which I'm thinking now that cannabis is a legal substance, might be easier for those studies to happen. And secondly, anybody thinking about this probably would be well advised to consult with their doctor about the possibilities and the potential problems of using cannabis in managing dementia.
Yeah, absolutely, because it's a good idea too, if you're considering cannabis for yourself or a family member, it's a good idea to have a very open discussion with your physician and talk about the potential benefits versus the risks and the side effects of that, and how suitable it is for you or your family member. And one more recommendation is that if at all you decide to go ahead with it, it is safer to go for a trial of the synthetic drugs. First of all, they come with clear formulations, dosage is more convenient, because you know exactly what you are taking.
More controlled.
Yeah, you can control the dosage, and at the same time these have been studied more, so you know exactly what to expect.
Great. All right. Well, thanks for joining us. Thanks everybody else for joining us today. If you have any questions on this topic or any other that is coming up for you, please feel free to reach out to us at either 403-290-0110 or at findsupport@alzheimercalgary.ca. We're planning to be back in 2 weeks with another video where we'll be learning about adult day programs. And if you have any questions on that topic in particular, please leave a comment on this Facebook post, and we'll try to make sure we address it in that video. And thanks again for taking some time to join us.
Thank you. Have a great day.